Hello everyone, I am Rakia, and today we'll talk about prevention and post-exposure protocols for healthcare workers. Needlestick injuries are among the most common occupational risks in healthcare. Even a small prick can lead to serious infections such as HIV, hepatitis B, or hepatitis C if not managed properly. In this session, we'll look at how and why these injuries happen, who is most at risk, and what to do immediately if an exposure occurs. Let's start by reviewing our learning objectives for this session. In this session, we have several key learning objectives. First, we'll define what a needlestick injury is and understand why it matters. Then, we'll identify which healthcare workers are most at risk, and in what areas or procedures these injuries are most likely to occur. We'll also discuss the devices that commonly cause injuries, and the factors that increase the risk of acquiring infections such as HIV, hepatitis B, and hepatitis C. Finally, we'll talk about the nurse's role in prevention and demonstrate practical ways to reduce the risk of sharp injuries. With these goals in mind, let's begin by understanding what a needlestick injury actually is. A needlestick injury happens when a healthcare worker's skin is accidentally pierced by a needle or another sharp object that has been used on a patient. This kind of injury might look small, but it can expose the person to serious bloodborne infections such as HIV, hepatitis B, or hepatitis C. These injuries can occur in any healthcare setting, during injection, blood drawing, or even while cleaning instruments. Understanding this definition helps us realize that even one small prick can carry a big risk, and that's why prevention and quick response are so important. Needlestick injuries are not rare. According to the CDC, around 385,000 cases happen every year in hospitals. Each injury carries a potential risk of transmitting HIV, hepatitis B, or hepatitis C, infections that can change a person's life completely. The people most at risk are nurses, laboratory staff, and cleaners, because they handle needles, blood, and contaminated waste every day. Beyond the medical risks, there's also an emotional and financial burden. Many healthcare workers experience anxiety, fear, and sometimes stigma after an incident. That's why understanding prevention and immediate management is not only about safety, it's also about protecting our confidence and peace of mind as healthcare professionals. Now, let's look at who is most at risk of getting needlestick injuries. Healthcare workers who come into frequent contact with blood or body fluids are the ones most exposed. According to the CDC and WHO, nurses make up the largest group, nearly 40 to 45% of all reported cases, because they perform injections, for insertions, and blood draws daily. Physicians, laboratory staff, and cleaners also face significant risk, since they handle sharp instruments, samples, and medical waste. Even students and interns are vulnerable, especially when they are still learning procedures. This means everyone in the healthcare system, from doctors to cleaners, needs to understand safe handling and disposal practices. Next, we'll look at where these injuries most often occur inside the hospital. In this slide, we can see where most sharps injuries happen. The highest number occurs in the patient rooms, about 39%, where nurses and doctors perform injections, IV insertions, and blood draws. The operating room comes next with around 27%, because of the frequent handling and passing of sharp instruments during surgery. In outpatient and emergency rooms, injuries account for about 8% each, often during quick procedures or when staff are under pressure. The laboratory contributes around 5%, usually while handling blood samples or testing equipment. The remaining 13% occur in other areas such as waste handling or cleaning tasks. This reminds us that sharps injuries can happen anywhere in the hospital, and everyone must stay alert and follow safety practices at all times. On this slide, we can see the most common devices that cause sharps injuries. According to studies, 6 devices are responsible for about 78% of all incidents. The first and most common one is the disposable syringe, which causes around 30% of the injuries, usually during injection or disposal. Next are suture needles, about 20%, mostly during surgical procedures when instruments are passed between staff. Intravenous catheter stylets and phlebotomy needles account for about 5% and 3%, often during blood draws or for insertion. Scalpels cause about 8%, while the butterfly fork catheter makes up roughly 12%, often because of its small size and flexible tubing, which can make handling tricky. These numbers remind us that every device we use carries risk, even the tools we handle most often and think are routine. On this slide, we're talking about the proper use of sharps containers, one of the most important parts of injury prevention. First, every sharps bin must be puncture-proof, leak-resistant, and have a tight-fitting lid. It should also be clearly labeled with a biohazard symbol, so that everyone knows what it contains. Next, it's very important to place the sharps container at the point of use, meaning it should be within arm's reach whenever sharps are used, like in a patient room, procedure area, or injection trolley. As we can see from the photos, the yellow bin attached to the trolley is the correct setup. It's close, stable, and easy to access. The bins that are hung too high or placed on the floor are unsafe, because they increase the chance of accidents or contamination. So, a good rule is, always dispose immediately and safely, without having to walk away from your working area. On this slide, we can see when sharps injuries most often happen. The majority occur during normal clinical tasks, especially when we're tired or distracted. Many happen while disposing of needles, for example, when a sharps bin is full or placed too far away. Others occur while administering injections or drawing blood, particularly when there's movement from the patient. One of the most common causes is recapping needles, as shown in the picture. This technique should always be avoided. Injuries can also occur while handling trash or dirty linens, when used sharps were not properly discarded. Finally, during surgery, IV insertion, or cleaning up after procedures, there's also a high risk because of multiple exposed sharp instruments. So, it's not just what we use, but when and how we handle these devices that truly determines our safety. This chart shows when most needlestick injuries actually happen. As we can see, the majority, around 70%, occur after the needle has been used but before it is disposed of. This means that the danger doesn't end once we finish the procedure. Many injuries happen when healthcare workers are holding, transferring, or trying to discard a used needle. About 20% occur before or during use, for example when giving an injection or drawing blood. And about 10% occur during or after disposal, often when bins are overfilled or when someone tries to push waste down. So, the key takeaway here is, most injuries happen right after the procedure, in that short moment before proper disposal. That's why we always say, don't delay, discard immediately. In this slide, we'll talk about the nurse's role in preventing sharp injuries, what we should do. The first and most important point is to place sharps containers close to the point of use. This means keeping the bin right next to you, within easy reach, so you can dispose of sharps immediately after use, without walking around or carrying them in your hand. Second, always use a needle cutter or needle destroyer if available. This helps reduce the risk of injury and prevents reuse of needles. Third, separate sharps from other types of waste. Never mix needles with regular trash or linens. Also, make sure to use rigid, puncture-proof containers. Soft or thin bins can easily break or leak. Finally, empty the sharps container when it's 3/4 full. Don't wait until it's completely full. Overfilled bins are one of the most common causes of accidental needle sticks. These simple steps can make a big difference in keeping both staff and patients safe. Now that we've talked about what nurses should do, let's look at what we should never do when handling sharps. First, never handle, empty, or transfer used sharps between containers. Once a sharp is inside a bin, it should stay there. Trying to move or rearrange it is one of the most common causes of injury. Second, never recap needles before disposal. The moment we try to put the cap back on, the risk of accidental puncture increases dramatically. If the needle must be recapped for a specific reason, use a one-hand scoop technique, but only when absolutely necessary. And finally, do not rush procedures. Take your time, even when the ward is busy. Most accidents happen when people are in a hurry, trying to save a few seconds. Remember, safety always comes before speed. Now let's talk about how to reduce needle stick injuries, the key steps that can truly prevent them from happening. First, use safety-engineered needles whenever they are available. These devices are designed to reduce the chance of accidental exposure by automatically covering or retracting the needle after use. Second, avoid recapping needles. As we saw earlier, this is one of the main causes of injuries. Once a needle has been used, it should go straight into the sharps container, no second handling. Third, when handling needles, always be very careful and alert. Used needles must be promptly disposed of in approved sharps containers only, not on trays, beds, or tables. Fourth, make sure you are fully vaccinated against hepatitis B. The complete series of 3 doses provides long-term protection, often lasting for life. And finally, in case of any accidental exposure, start post-exposure prophylaxis, or PEP, immediately. Don't wait, early action greatly reduces the risk of infection. Prevention starts with awareness and good habits. Every small step makes a big difference in protecting ourselves and our patients. Now let's look at how to manage a needle stick injury, what to do immediately after it happens. First, do not panic. Stay calm and focused. Never put your finger in your mouth or try to squeeze the wound to make it bleed. This can cause more tissue damage or infection. Second, wash the wound immediately with soap and running water. Clean the surrounding area as well, and rinse thoroughly. Do not use harsh disinfectants or bleach directly on the wound. Third, document every exposure, write down what happened, when, and what type of device was involved. Then, report the incident immediately to your supervisor or manager. Early reporting is critical because post-exposure treatment, PEP, must begin as soon as possible, ideally within the first few hours. Remember, the first response determines your safety. Calm action, proper cleaning, and early reporting can make all the difference. This chart compares the risk of infection after a needle stick injury with 3 major viruses: hepatitis B, hepatitis C, and HIV. As we can see, hepatitis B carries the highest risk, with about 30%, or 30 out of 100 exposed workers, possibly becoming infected if they are not vaccinated. For hepatitis C, the risk is much lower, around 3 to 5%, meaning about 3 to 5 people in every 100 may become infected after exposure. And for HIV, the risk is very low, about 0.3%, or roughly 3 in every 1,000 exposures. So, while the risk of HIV transmission is minimal, all exposures must still be treated seriously, because even a small risk is too high when it comes to bloodborne infections. The good news is that vaccination and proper post-exposure management can prevent almost all cases of infection, especially hepatitis B. Now let's talk about post-exposure prophylaxis, or PEP. PEP means taking antiretroviral drugs after a possible exposure to HIV, for example, after a needle stick injury involving contaminated blood, in order to prevent infection. It's very important to remember that PEP is an emergency treatment, not something to wait on or think about later. The medicine works best when started as soon as possible, ideally within 2 hours, and it should be taken for a full 28-day course. Even though the risk of HIV transmission is low, starting PEP quickly gives strong protection and peace of mind. So whenever there's any doubt, report the incident and ask for PEP immediately. Now let's review the general guidelines for post-exposure prophylaxis, PEP. First, every case of occupational exposure should be carefully assessed. The potential benefits of PEP must be weighed against the potential risks, and the healthcare worker must be fully informed about both. Once PEP is started, adherence and possible side effects should be closely monitored throughout the 28-day treatment. Next, it's important to perform a baseline HIV test for the exposed staff, together with counseling and follow-up. Ongoing counseling and repeat HIV testing should be done at recommended intervals, usually at 6 weeks, 3 months, and 6 months after exposure. Finally, the staff member should be monitored for drug toxicity or any adverse reaction from the PEP medication. The goal is not just to prevent infection, but also to support the healthcare worker physically and emotionally through the follow-up period. These are the steps for post-exposure prophylaxis, starting with immediate first aid. The very first action is to stay calm and perform immediate wound care. If there's skin exposure, wash the area gently with soap and water, do not scrub or use harsh chemicals. If the exposure involves mucous membranes, like the eyes or mouth, rinse immediately with plenty of clean water or normal saline. Do not use bleach, alcohol, or antiseptic solutions directly on the wound, these can damage tissue and do not prevent infection. After first aid, report the incident immediately to your supervisor. Next, go to the Infection Prevention and Control (IPC) or Occupational Health Unit for further evaluation. Make sure to document the incident, including the date, time, and type of exposure. If indicated, start PEP as soon as possible, ideally within 2 hours. Finally, follow up with blood testing and counseling to monitor your health and ensure proper support. The key message is, don't delay, act fast, and follow the full process. Now let's summarize the key points of post-exposure prophylaxis for different infections. For HIV, PEP should be started as soon as possible, ideally within 2 hours after exposure, and never later than 72 hours. The standard treatment uses a 3-drug regimen taken for 28 days. Remember, the earlier it begins, the more effective it is. For hepatitis B, if the exposed person is not vaccinated, give the hepatitis B vaccine and HBIG, that means hepatitis B immunoglobulin, as soon as possible, preferably within 24 hours. For hepatitis C, currently, there is no preventive medication available, but the exposed person should be closely monitored with regular blood tests to check for any sign of infection. So, in short, act quickly, follow protocol, and complete the follow-up process for every exposure. Let's look at this case. A nurse gave an injection, then tried to put the cap back on the needle, and accidentally pricked her finger. She only rinsed it with water and didn't report until the next day. So, what went wrong? She recapped the needle and reported too late. What should she have done? Wash with soap and water, report right away, and go to IPC or Occupational Health for PEP. How to prevent it? Never recap, keep sharps bins close, and report immediately after any injury. Let's check what we've learned with a quick review. First question, what's the first action after a needle stick injury? Wash with soap and water. Second question, when should HIV PEP be started? Within 2 hours after exposure, remember, the sooner, the better. Last question, which virus has no PEP? That's right, hepatitis C. There's no preventive medicine for Hep C, so follow-up testing is very important. Before we finish, let's review the key take-home messages. First, needle stick injuries and body fluid exposures are medical emergencies. Don't wait. Act immediately. Second, always follow standard precautions. That means wearing gloves and disposing sharps safely every time. Third, report every exposure right away. Reporting helps you get the right evaluation and treatment in time. Next, start HIV PEP within 72 hours, ideally within 1 to 2 hours. The earlier you start, the more effective it is. Hepatitis B can be prevented with vaccination. Make sure you are fully immunized and your antibody level is checked. And finally, there's no PEP for hepatitis C. So early follow-up testing is very important. Remember, safety starts with you. Let's continue with the key points. First, initial wound care is essential. Wash the wound thoroughly with soap and water, and rinse well if it's a mucous membrane exposure. Second, follow-up testing and counseling are necessary. This helps detect any possible infection early and gives emotional support. Third, healthcare workers must be trained and equipped to manage exposures safely and effectively. And finally, prevention is the best strategy. Use safety-engineered devices and always follow infection control protocols. Thank you everyone for your attention and participation. Remember, safety starts with you. Each small action, like proper sharps handling, protects not only yourself, but also your colleagues and patients. Let's keep working together to make our hospital a safer place. Thank you.